morning, afternoon, or evening if you're where our physio Otieno Martin is right now in Nairobi, Kenya. So welcome to the AAMPT interview with the expert. We're so excited to have you. You're also known on your social media handle as the Kenyan Physio. So can you tell us a little bit about yourself and your background as a physio?
Awesome. Thanks for having me. I appreciate this, and thanks for reaching out. My name is, as you said, so you did pronounce it correctly. Did a marvelous job on that. Otieno Martin. I'm a physiotherapist from Nairobi, Kenya, and I play the role of being an educator, of being a clinician, and being an advocate for physiotherapy or physical therapy, or even doctors of physical therapy, depending on where you come from and the level of training that you've had. So that's me. I eat, sleep, work, do whatever physiotherapy. It has to be. It's integrated. Yeah. So that's about me. And I've not been to the US, only in movies, I guess. I think I've seen enough movies to be an American partly. But I've been to a few conferences where we had groups of physiotherapists who were, having the common language of trying to improve the profession and also trying to, advocate for being better clinicians to their patients. So the WCPT is one of them. The Reasoning, Reform, and Responsibility Conference that was organized in the UK a couple of years back by Choose Health and Connect Health. So Netherlands as well. So I got invited to the Netherlands to speak at an international week in a school. So that's me. I think that's all I can gather about myself.
Well, Martin, and I met you at WCPT last year in Switzerland, and you really have developed a name for yourself internationally. I mean, I think a lot of people know you as the Kenyan Physio. What is our profession like in Kenya? What is your practice? What is our practice model? I know that you're an educator, you're involved in education. What is that like as well when you compare it to kind of other countries?
Physiotherapy in Kenya or in Africa is pretty young, I would say. So if I compare, so when I was in Geneva for the WCPT conference in Switzerland, they were celebrating 100 years of PT, which was so exciting. And I think we are 50 years old now, so as a profession, we're still pretty young and we are growing, but we've had a lot of tremendous strides, which have not been easy to kind of achieve, but that is where we are headed. And so physiotherapy in Kenya, we still have diploma training. So you have a diploma certificate that you have 3 years of deductive and inductive training where you there's a lot of, so in the diploma there's a lot of practical aspects to training, where most of it is done in the hospital. So you train around the hospital environment. Of course, there's the college bit of it where you have a lot of textbook knowledge that you get to gain. And then we are based in a majority of the hospitals, so the leading hospitals in Kenya, depending on whether it's a rural hospital, depending on whether it's a teaching and referral hospital. So we are based in such institutions. And we have a number of physiotherapists who have private clinics as well. So that's it.
Thank you for sharing that. When we first got on this call, we were talking about that you had just had some telehealth visits Can you tell us a little bit about what you're doing right now in practice? Because you were telling me you're doing some pro bono work.
Oh yeah, so I previously I used to work for the Jackson's Foundation, and also I used to teach at the Kenya Medical Training College, which was the institution that I got trained at. So at the institution right now, we have a diploma in physiotherapy, we have a higher diploma in orthopedic manual therapy, and then we have a higher diploma in neurorehabilitation. And lastly, we have a higher diploma in women's health and training. So we're still trying to find out how to incorporate the women's health training into a name that can fit a higher diploma training, since it's specialized training. So it's an institution that only provides diplomas. So the government does not mandate it to provide a bachelor's degree, for example, despite the fact that the OMT training, orthopedic manual therapy training, is advanced training. Despite the fact that the neurorehabilitation was advanced training, you cannot call it anything other than a higher diploma. So that's technically how the education system looks like. And as you mentioned earlier, so right now what I'm doing is trying to look for a job, because we have to find ways of paying our bills. So right now what I'm doing is, amidst looking for a job, I'm doing a lot of pro bono work. So I'm seeing cancer patients online, which is a pretty new ideology. The telehealth system is a very new ideology in the Kenyan and in the African system. And it's considered, why would I pay for, just having a conversation with someone or having a few demonstrations of exercise here and there with somebody else. So, but that is, from the feedback I'm getting from the patients, is it's something that is really helpful for them. And considering right now where we have, COVID-19 is here with us, it's our new reality, and we have to look at ways of minimizing infection or minimizing the spread of the disease. So a lot of the patients who have chronic conditions are afraid of either going for their normal clinics or going to hospital environments, because that's where everybody who's sick goes to. So I'm trying to just provide solutions to, hey, I can offer some sort of help for you during this period of time. And from the feedback there, as in the patients are like, this was helpful for me. I feel relief. I feel great. I feel like I did something, and I feel like my joints are free to move. So those are some of the words that they're using. And to me, that's what drives the passion. That's what, as long as I can help people live better and have a quality life in terms of their daily activities, that's what I'm doing right now. And I'm also teaching and mentoring the physiotherapists who we had trained. So if any physio reaches out to me for help, I'm more than happy to, let's see the patient together. Let's figure out how to go about the problems that you're experiencing, and also let's share ideas of treat patients. So right now that's what I'm doing, but I'm also doing the work of looking for a job, since it's work looking for a job back home. So, yeah.
Well, you mentioned you were working for the Jackson Foundation before, and I know that Richard Jackson was a private practitioner in Virginia, and grew his practices, multiple practices, and I think years ago went to Kenya and started to get involved with your association there. Tell us a little bit more about that Jackson Foundation and what projects and opportunities kind of exist there.
Awesome. Yeah, Richard Jackson is a very amazing human being, and he's been very instrumental in the growth of physiotherapy in Kenya, not just in Kenya, but in Ethiopia as well. So we have a DPT program in Africa. Woo! So Ethiopia was providing a DPT program and that was thanks to Richard Jackson. So what the foundation did is they identified some of the best educators in the U.S. and they kind of got them to Kenya, and they started the orthopedic manual therapy training program. Which was I was a student there at the beginning, so I've always been really keen at looking at how do I best improve my knowledge in terms of helping the patient in front of me. And to me, I was like, the training that we've had, or the training that we previously had, was about TENS, hot pack, traction. It was more or less a training of being a technician. So you got a prescription from a doctor, you got instructions from somebody else who had a superior pay grade from you or some sort of superior training, and then you initiated or tried to facilitate whatever they had instructed you to do. So that has always been the training. But in my clinical rotations, I was like, I used to talk to patients, and I was like, what bothers you? What brings you to the clinic today? And they will be like, back pain. And then I'm like, okay. So how do we help you, get rid of your back pain? And I will ask, how long have you had the back pain for? I'll be like 20 years. 20 years of having back pain, and you're still coming to the same institution for the same exact treatment. Don't you think you need something else? And don't. So my question to myself at the time was, I feel, that we should do a better job in addressing our patients' problems rather than them seeing us for 20 years. Something is not right in that perspective. We are not doing something to help the patient. Rather, we are doing something to make the patient keep wanting to come, but we are providing short-term solutions to problems that need long-term solutions, for example. So I was always questioning that, and that's why I got into the training. So when the OMT program started, of course, it was met with a lot of resistance because it's something new, and people were like, what is that? What is that form of new training that's on there? But to me, I found that as this is what I was looking for. This is us providing solutions to our patients that could be short-term or within a short period of time, but we have long-term effects to the solution that we provided. And that's how I got into the training. And, over the years, we were, myself, a brother of mine called Henry, and Erastus got selected to be like teaching assistants. So the whole idea was to start the program, have Kenyans trained in teaching the program, and then, back off, which I think is a very great model of, having an non-governmental organization, for example, is teaching people how to be efficient by themselves, and also teaching them to teach other people to be efficient by themselves. So, and yeah, they still run the program. We still have, so up to now we've had neuro rehabilitation, we've had exercise prescription as a continuous ed. We've had, advanced classes in, for example, advanced vertebral manipulation. And we've had the women's health, which has had a very massive impact in Kenya. And of course, if you want to visit, Africa, if you want to come to Kenya, that's one of the platforms that you can use to, come see what we do over here. And you're welcome. As in, if you feel you need to, leave the US for 2 weeks, 3 weeks, come on over. You're more welcome home.
Who have you guys had? I know you've had like Jake Magel, several AOMP people that have been involved in AOMP. Who else?
We've had Brett Windsor come over, so he's one of my key mentors. We've had Rob Landell come over. We have Amy Catland. We've had Steve Tepper, Helen Helegas. So some of the like really big names, if I follow
Yeah.
the American Association of Physiotherapists, so we've had amazing physios, Michael Barasa, and I've been lucky to have met almost all of them, and we built long-lasting relationships, and we still communicate back and forth. And it's amazing, as in it provides you a different environment, or rather, a different way of seeing what physiotherapy can actually be in terms of addressing patients' problems. So, I mean, you're all welcome, and you can have a look at the Jackson's Foundation, and they still have amazing things that they're doing, and I'm still part of them. Despite not getting a salary from them, but I'm excited to be a part of the foundation, and I'm excited to be an alumni of the foundation. And yeah, anytime you guys come to Kenya through the foundation, you're definitely going to meet me at some point. Yeah.
Thank you for that welcome. You can tell your face just lights up when you talk about teaching, and you can just tell you're really dedicated to excellence in all you do. It brings up my next question would be to tell us a little bit about what you think that long-term solution is in Kenya. I know that you have a fitness-forward mentality for health and wellness and providing access to your patients. Can you tell us a little bit about what that looks like in your own personal practice and prescription?
I'm in love with exercise, fitness, and movement in general. You can call it anything. You can call it physical activity, you can call it exercise, you can call it movement, you can call it some sort of correction to how people move, or trying to look for an ideal way of how people move. But if you look at the benefits of physical activity and movement and exercise in general, they play a big role in terms of keeping us healthy. And I look at it from a disease prevention perspective. It's expensive to have a chronic disease, I think anywhere in the world. It's expensive to have a chronic disease in Kenya. And a lot of the cancer patients that I'm treating, I don't even know how to tag them. Like I don't, it's not that I can survive without salaries. That's not the case. But if I look at the environments in which these people live, and the amount of money they spend on radiotherapy, chemotherapy, without any support whatsoever from the government, or rather from the National Health Insurance Fund, it's a disaster. People sell their lands, people sell cows, people stop their kids from going to school because they have a chronic disease condition. And I look at exercise as, hey, why don't we prevent you from developing a chronic disease? And even if you get it, God forbid, even if you get it, your body is prepared to battle whatever is coming ahead, because you're physically fit. And we know from numerous studies that if you're physically fit, your outcomes with surgery are better. If you're physically fit, it's easier to treat. I sprained my ankle when I was playing football, as compared to, I have low back pain that has been there for a long period of time because of a sedentary lifestyle. So that makes it a little bit difficult to treat this patient. And that's why I'm so excited about fitness. I'm so excited about movement and exercise in general. And that's the leverage I try to use to educate my patients. And some people say that Africans, or rather Kenyans, are fit, but we are starting to develop sedentary lifestyle behaviors. It's starting to be on the rise. It's increasing, and people are not seeing that because, of course, the better job you have, or the better paying, if you have a better paid salary, you have access to alcohol, you have access to, having, let me give an example of KFC, because we have KFC in Kenya as well. So you have better access to like eating KFC over the weekend, or even more often. So fries, chips, and all this, if you look at it from a nutritional perspective, you have access to some of these foods that are not good for your health. And you also have access to the luxury of partaking in alcohol, almost, drinking alcohol almost every other weekend. And that has been the trend with a lot of the younger generations of Kenya. Whenever they get a good paying salary, they start to develop a lot more sedentary behaviors. And there's no research around it. I don't have the money to do the research around it, but I can see it. And it's something that is on the rise. So I'm always there trying to educate Kenyans or my patients about, this is how we used to move. We dance in weddings. That's there's some element of dance. There's some element of beauty of walking to school. There's some element of walking to places where we we need to go to. But we have motorbikes now. We have motorbike riding is like a new element of transport, and everybody wants to be on a motorbike. Even in places where they used to walk, they have a motorbike. I'll just get on a motorbike and somebody's riding it, and it uses fuel, and I can afford it. So we are looking at, let me give it 10 years from now, we'll have a rise of sedentary behavior in the African population, which I'm afraid we can't afford it. We can't afford to have chronic conditions. We can't afford to have a rise of the numbers in non-communicable diseases. We can't afford it. We don't have proper healthcare systems in place. Of course they're there, and there are people working around the clock to ensure that they exist. But it's not adequate, and the numbers are showing it. So that's why I'm, enthusiastic about exercise, and it doesn't have to be complicated. I don't have access to the gym, so I can't afford to pay for a monthly subscription to the gym. But hey, I have a jerry can of water, which is 20 liters. Fill it with water, that's 20 kgs. If you have a good physics conversion, it's 20 kgs, right? If you feel that it's light, fill it with sand. That makes it even more heavier, So those are some of this, some simple solutions that we can use. Or sometimes we, put concrete, mix it with sand and a few stones, and then put it in bottles of jerry can to make it even more heavier as part of like a strength training or other weighted exercise. So I'm a big fan of, we can be as creative as we can get with exercise and or movement as much as possible. And it can be as simple as a cultural dance when you go to a wedding. It can be as simple as a walk. Let's take a walk through the village. Let's go herd cattle, which the modern way of living is making herding cattle look like that is not something you're supposed to do if you've been to school. And I feel like that is me connecting with, another animal, but I'm also connecting with nature. And these are some of the practices that I try to encourage within the African community, that, hey, we can still practice those and still have a PhD, for example, or I can still be a doctor of physical therapy, but I'm herding cattle. The society is changing. It can be a very difficult area to navigate around. So yeah.
I think, Eric, are you talking? He's talking. Let me see. Mute, unmute.
Your pictures on Twitter and Instagram of these, the workouts that you guys do and the equipment that you build, I just think it's so neat and inspiring. So everybody needs to follow the Kenyan Physio on Twitter and Instagram. And then you're presenting, Martin. You have some presentations coming up. You have a conference that's by a group out of the UK coming up recently. And then talk a little bit about your next WCPT is in Dubai, and I know you're presenting there as well.
Yeah. Nathan. So I have a friend out of Netherlands called Nathan Hatting, and he reached out to me and he was like, "Hey, I would really like to be, part of the focus symposium on patient-centered care." And yeah, I was like, "Yeah, I'm excited about that." And I would like to, provide a few insights on what I do in terms of trying to address provide solutions to some of my patients' problems, but also try to make it feel like this is like a partnership of us trying to figure out what the problem I have can be and how it can be addressed. So I'm excited to be presenting at the WCPT, and so the WCPT also offers scholarship. I can't afford to go to Dubai, so if I decided that I want to go to Dubai, I can't afford it. I have a scholarship to go present at the WCPT, which is an opportunity I look at it as an opportunity to connect with like-minded people around patient care, around leadership, around improving education, around letting the world know what we do as physiotherapists. And that's how I view the WCPT. And it's through the WCPT that I've gotten into different rooms. So my first conference was in the UK, and that was my first experience of being in a room full of physiotherapists who are looking at how do we improve quality of care? How do we improve leadership skills? How do we improve how to reach out to the world and explain to them what we do? Physiotherapy in Kenya is not that well known to the community. People still don't understand what we do. Most of the people who've come across a physiotherapist have had a stroke, they were in a road traffic accident, and they were in an orthopedic ward. A lot of people still don't understand our role in addressing musculoskeletal conditions, which is, I think it's our fault. We don't do a very great job of trying to let people know what we do. We let them find out the hard way, which I think we could jump a lot of hurdles. And of course, there's the bureaucracies, there's physiotherapist, and I'm a medical doctor, and I'm an orthopedic surgeon, or I'm a neurosurgeon. I've had a lot of years of training compared to what you've had. I operate the human brain. You only prescribe movement of a joint or a shoulder joint, a knee joint. So there's the element of, and of course, there's a lot of bullying in the medical system in Kenya, and I think it's also happening in the rest of the world, where people who've had some good quality training, for example, feel like those who've not had the same training, or those who've not been in the same school as they went to, are inadequate in terms of professionalism, which I don't think it's the right approach to address the health problems that we have. I feel that if healthcare providers can sit in a room and have, an open discussion on, hey, what do you do as a physiotherapist? What do you do as an orthopedic surgeon? What do you do as an occupational therapist? What do you do as a nurse? Then if we have that collaborative and collective thinking, who benefits? The patient, right? So we still have those problems. And I feel that it is such environments that you get to understand or interact with people who've had challenges like you've had, for example, or probably have had an experience with a challenge that you have. And if you get to ask them, hey, how did you overcome that challenge? You're provided the answers. So, and my reason for joining social media was because I needed to find out uh, a physiotherapist who I read on a book, or a physiotherapist who was vocal on Twitter or on Instagram, or had a podcast. So I used to listen to the Physio Matters podcast, which was like a class environment for me. Karen Litzy has, Healthy, Wealthy, and Smart podcast, which was another class environment for me. Since my normal classes were, me being taught by either an external lecturer from the US or an internal lecturer from Kenya, but I had classes online. There was somebody on Twitter mentioning a research article. There was somebody on Instagram mentioning kind of like creating infographics about rehabilitation of tendons, and it is through such environments that I got to actually learn. And what I did was, hey, I popped people, I reached out, I sent messages. And that is, sometimes it's weird, sending messages to people who you've never met. They think it's a hoax, or they think it's some African scam, or there's a lot of work that you need to do before you get connected with somebody online. And this is WCPT and the conferences have provided me the opportunity to meet these people in person, and you can be very vocal on Twitter, and you can be very critical on Twitter to the extent that I get scared because I've not done research yet. So when I see a researcher posting on Twitter and they're very adamant on their research topic, I feel like, oh my God, how do I even contribute to this conversation? But meeting some of these people in person was like, hey, I've been watching your videos, and I met you. That's how I met you, Eric. I told you I know you when we met at the WCPT because I was watching the ICE videos. And it was exciting to see solutions, on how to treat, let's say, foot and ankle, shoulder pain on Facebook. And then I will try the exact same thing that you did on social media. And if it fails, guess what I will do? I'll reach out to you and say, hey, I did exactly what you did, but it failed. And probably it was a contextual factor that was involved in, I was providing something that I didn't understand how to provide. So the best way is to reach out and ask, hey, I did the exact same thing, and these are the steps I followed, and could you advise on how best I can do it again, for example? And that's the WCPT for me. And if I can be able to meet different physios from different parts of the world with different stories, everybody has got a story, everybody has got a journey, that it'll be great to understand, what's your story like? How is it walking in the desert? How is it prescribing exercise to somebody who lives in Dubai, for example? The sun is shining, it's super hot there. But how do you encourage your patient to do some sort of physical activity? How do you provide physical activity to somebody who thinks that they work all day, they're already factoring in their physical activity, numbers. So if you tell them, hey, you need 150 minutes of exercise, they're like, what do you mean? I do house chores, but your house chores do not match the amount of physical activity you need to make your shoulder healthy, for example. So it's these stories that have made me interested in, I know you have the CSM, which a lot of people have been talking about, and I want to come to that. It'll be fun to meet a few of the Twitter physios that I've interacted with in person. Get to understand, hey, you tweeted about this. What was the reason to your tweet about it? And I can also share my stories, which is a great platform to learn from one another.
We need to get you there next year. This February in Orlando is CSM, so we gotta get you there.
That would be great.
Well, thank you, Martin. You're such a good inspiration. I think you bring us all together. You clearly want to make things happen. You take action. You want to make changes and improve things when you see them. So, you know, we are all so lucky and proud to have you as part of our profession. And thank you so much for taking the time to talk with us today.
Yeah, thank you for your
Oh,
time.
appreciate that. Yeah.